Hello, ladies. Let's chat about something natural and normal, your period. We're familiar with the classic image of period blood as bright red, but your menstrual flow can surprise you with shades from deep brown to light pink. This rainbow of red is usually nothing to worry about. The hue can vary from cycle to cycle and even within the same period. Factors like time inside the uterus and hormone levels influence the color. It's about oxidation, like how a cut apple turns brown when exposed to air. Let's decode the language of your flow, shall we? Remember, these are general guidelines and everyone's body is unique. Bright red. This lively hue typically signifies fresh blood recently released from your uterine lining. It's often seen during the heaviest days of your period, when your flow is at its peak. Dark red. As mentioned earlier, this shade usually indicates older blood that's been hanging out in your uterus a bit longer. It's common at the beginning or end of your period when the flow is lighter. Cranberry red. This shade falls somewhere in between bright and dark red, signaling a healthy, normal flow. You might notice this color during the middle days of your period. Remember, the color of your period blood can change throughout your cycle and from one period to the next. These variations are usually normal and no cause for alarm. Now let's address the elephant in the room, or rather the black sheep of the period color family. Seeing black blood on your pad or tampon can be alarming, but in most cases, it's not a cause for panic. Black period blood usually indicates old blood that's been oxidized and has taken a while to leave your uterus. Imagine it as the last bit of leftover paint being squeezed out of a tube. It might look different, but it's still paint. However, if you experience black discharge alongside other symptoms like foul odor, itching, or pelvic pain, it could be a sign of an infection or other underlying medical condition. In such cases, it's crucial to consult your doctor. Mythbuster. Contrary to popular belief, black period blood doesn't mean you're cleaning out your vagina. Your vagina is a self-cleaning champ and doesn't need any help from black magic or special detox rituals. Section 4. Brown to bright red. What your flow's hue reveals. Besides black, your period blood can paint a canvas of other hues, each with its own story to tell. Brown blood usually signals older blood, often seen at the beginning or end of your period. Orange can be trickier. Sometimes normal, but with a foul odor, it might indicate an infection. Grayish blood can be a red flag. It might signal an infection or miscarriage. Contact your healthcare provider immediately. Your body communicates through period blood color. Pay attention for health insights. Section 5. Pink or spotting, early pregnancy, or something else. Now let's talk about the lighter side of the spectrum, pink and spotting. Pink, light pink blood, especially at the beginning or end of your period, is usually normal. It can result from light bleeding or blood mixing with cervical fluid. However, pink spotting between periods can sometimes be an early sign of pregnancy, often referred to as implantation bleeding. Spotting. This refers to very light bleeding, often just a few drops that occurs between periods. While spotting can be caused by various factors, including hormonal changes, stress, or certain medications, it can also be a sign of underlying medical conditions. If you experience frequent or unusual spotting, consult your doctor. It's important to note that pink discharge or spotting can also be caused by other factors such as ovulation bleeding, cervical polyps, or even sexually transmitted infections. Don't jump to conclusions. If you have any concerns, your doctor can help determine the cause. Section 6. When in doubt, reach out. Seeking professional guidance. Navigating the world of periods can feel like deciphering ancient hieroglyphics. While this guide provides a general overview, it's essential to remember that every body is unique, and what's normal for one person might not be normal for another. If you experience any of the following, it's time to pick up the phone and schedule an appointment with your doctor. Excessively heavy bleeding, soaking through a pad or tampon every hour. Prolonged periods lasting longer than 7 days. Severe menstrual cramps that interfere with your daily activities. Unusual or foul-smelling discharge. Bleeding between periods. Pain during intercourse. Remember, you are your own best advocate when it comes to your health. Don't hesitate to seek professional medical advice if you have any concerns about your menstrual cycle or overall well-being. Your doctor is there to listen, answer your questions, and provide personalized guidance to help you feel your best.